Welcome to the deep dive. Okay, so for years, maybe decades, right? The advice for a healthy mouth felt, well, pretty simple, almost aggressive, really.
Brush hard, floss like crazy, and rinse with something that felt like it could strip paint. That was the mantra.
Exactly. But things are changing. We're seeing this quiet shift, sort of a revolution happening in oral care, maybe even right there in your bathroom cabinet.
It's a really interesting move away from what you might call chemical warfare in the mouth. Our goal today is to give you the shortcut, the inside track, on why dentists are talking less about killing all the bacteria.
And more about, like, cultivating the right kind, like gardening.
Precisely. Cultivating the right ecosystem. We want to dive into the science behind this, the whole idea of the oral microbiome, and why products like, say, ProvaDent are becoming part of this new conversation.
So yeah, going from sledgehammers to sophisticated gardeners, that's the idea. We want you to really get why your dentist might suddenly start talking about supportive bacteria, the good guys, and what that actually means for your health long term.
hmm Historically, it was all about elimination. If it lived in your mouth, the goal was scrub it out, sterilize it, sack pick.
Get rid of it.
Yeah, but now research is showing us the mouth is this incredibly complex living ecosystem. We call it the oral microbiome. And when it's balanced, it actually helps defend against disease.
Okay.
But when it gets out of balance, that's a state we call dysbiosis.
Yeah.
Well, then the troublemakers, the pathogens, they get the upper hand. And that leads to cavities, gingivitis, uh, even that persistent bad breath.
Right. And the key thing here, the hook, is that this isn't just some new marketing spin, is it? It feels like a fundamental change in how we approach prevention.
It absolutely is. It's
Yeah.
about recognizing that real health comes from balancing the whole community in your mouth, not just trying to sterilize the environment constantly.
Okay, let's really focus on this change then, because we did rely on those, harsh antimicrobial things for so long. What actually pushed dental professionals to make this pivot, to move away from sterilization and towards like actively supporting the mouth's own defenses?
Yeah, it wasn't just one single aha moment. It was
Yeah.
more like four different factors coming together. The first is that big philosophical shift we just touched on, realizing the old antimicrobial strategy is just,
Well,
well, it's too blunt an instrument.
like using a flamethrower to weed a garden.
Exactly. When you use those strong antiseptic mouthwashes, you're killing off everything. The weeds, sure, but also the beneficial flowers, the good bacteria that we're actually helping.
And I guess if those good ones were keeping the bad ones in check.
You've just created a wide open space for the pathogens to rush back in, maybe even stronger than before.
Ah, okay.
So the probiotic approach, it's different. It aims to specifically repopulate or boost the beneficial strains, the ones that can naturally outcompete the bad guys for, space and food.
Makes sense. What else drove the change?
The second big factor is just the sheer amount of research that's emerged. Good quality studies, too. We're seeing actual evidence linking specific strains of oral probiotics to measurable improvements, like reduced signs of gingivitis or lower levels of the bacteria we know cause gum disease.
So the science is catching up. But I imagine there's a human element too. Like, are people just fed up with that burning sensation or the chemical taste? Wanting something gentler.
Absolutely, that's the third factor, patient demand. People are actively looking for options that feel more natural, that work with their bodies rather than attacking them. They like the idea of support for their oral health.
Yeah, I can see that.
And the fourth factor is how dentists are viewing this. It's seen as an adjunctive therapy, a supportive tool. It's meant to complement your regular hygiene, the brushing, the flossing, not replace it. That's really important.
Right, so it's an assistant manager, not the CEO of your mouth health. Okay, that makes sense. So let's get into the mechanics then. If the goal is encouraging the right microbes, how do these beneficial bacteria actually do that? What's happening on a practical level when someone uses a product like ProvaDent?
Okay, so it basically comes down to controlling the territory and kind of communicating with the local environment in your mouth. There are about four main ways they work. The first is something called competitive exclusion.
Competitive exclusion.
Okay, think of all the surfaces in your mouth, your tongue, your gums, all those little crevices as limited real estate, prime locations. If these beneficial bacteria, especially the fast-growing ones, set up shop there first,
They take all the good spots?
pretty much, they use up the space and the available nutrients, essentially starving out the pathogenic bacteria. There's just no room or food left for them.
So they're like putting up no vacancy signs everywhere the bad bacteria want to live.
That's a great way to put it.
Yeah.
Exactly. Now, the second mechanism is really key. Biofilm modulation. When we talk about plaque.
Yeah, that fuzzy stuff.
Right. That's actually a complex community of microbes living together in what's called a biofilm. Oral probiotics can actually get in there and subtly change the structure or the behavior of that biofilm.
How so?
They can make it less sticky, maybe less acid-producing, and crucially, less likely to provoke inflammation in your gums. They're essentially remodeling the plaque to be less aggressive, more neutral.
Wow, okay. So turning bad neighborhoods into better ones.
Sort of. The third mechanism involves the body's own defenses, immune modulation. Certain probiotic strains seem to encourage a healthier, more balanced immune response right there in the gum tissues. This helps reduce overall inflammation, making the environment less friendly for severe gum disease to take hold.
Interesting. And the fourth, you mentioned four.
Right, the fourth is one people often notice pretty quickly. Production of malodorous compounds. Bad breath, basically.
Ah, the VSCS.
Exactly, volatile sulfur compounds. Probiotics directly compete with and can inhibit the specific microbes that produce those smelly VSCs. They tackle the source of the bad breath.
Okay, that's a big difference, tackling the source versus just masking the smell with mint. But you mentioned these are ecosystem effects. Does that mean you don't get that instant, fresh feeling like you do from a strong mouthwash?
That is the trade-off, and it's why understanding this is so important. You're waiting for an ecological shift to happen in your mouth.
Oh,
It
wow.
takes time. The real benefits, the healthier gums, the more stable breath they develop gradually, over days or even weeks of consistent use, as this new bacterial community establishes itself. It's definitely a long game, not an instant fix.
Okay, let's get down to brass tacks then. For someone listening, they've got these two different tools now. You've got the traditional antiseptic mouthwash, often fast, maybe cheaper. And then you have this probiotic approach like ProvaDent, which sounds like it needs more commitment, maybe costs more. When is one better than the other? How do you choose?
It really comes down to their fundamental purpose, their approach. Traditional mouthwash works by killing or inhibiting bacteria using chemical antiseptics, think chlorhexidine or essential oils. Its goal is immediate, short-term reduction of the bacterial load. Full stop.
Zap everything now.
Pretty much. The probiotic approach, on the other hand, is all about long-term rebalancing. It's about supporting the ecosystem, nurturing the natural defenses.
Okay, but that speed difference seems crucial. If I, say, ate a ton of garlic and have a meeting in an hour, the traditional rinse wins, right? For speed.
For sheer speed of killing bacteria right now, yes. Traditional is fast. It gives you that temporary reduction. But the key word is temporary,
Why temporary?
because the bacteria usually bounce back really quickly, often within hours, or certainly by the next day. So the downside is you have to keep using that strong chemical to maintain that low bacterial count, constantly disrupting your microbiome.
Ah, I see. Whereas probiotics.
Probiotics are slower to start. You need that build-up time, maybe weeks, but the payoff is the potential for a genuinely long-term shift in the ecosystem, a more stable balance.
So that points to totally different situations for using them. When would a dentist still recommend that traditional hard-hitting approach?
Yeah, the traditional antiseptic rinses really have their place in acute situations. Think short-term management, like really bad halitosis that needs immediate control, or maybe after dental surgery to prevent infection, or during treatment for a specific oral infection, but always under professional guidance.
Got it. And probiotics are more
Probiotics are really designed for the ongoing daily maintenance, supporting gum health day-to-day, keeping breath stable naturally, promoting that overall microbial balance. You'd use them every day, right alongside your normal brushing and flossing routine.
Okay. And are there downsides to relying too much on the traditional stuff long-term, besides just messing up the good bacteria?
Well, yeah, depending on the formula, long-term use of some antiseptic rinses can potentially lead to things like tooth staining. Chlorhexidine is known for that sometimes, or maybe even changes in how you taste things, though that's usually temporary.
And the risks with probiotics.
The risks are different. It's mainly that everyone's microbiome is unique, so the response can vary quite a bit from person to person. And the big one, they cannot treat active established disease. If you have advanced periodontitis, probiotics aren't a substitute for getting professional treatment. They can support healing, but they won't cure it on their own.
That's a really important distinction, which leads us perfectly into practical advice. If someone listening decides, okay, I want to try integrating an oral probiotic like ProvaDent, what are the key things dentists tell patients? How do you make sure you're actually using it effectively?
Right. First and foremost, the message has to be crystal clear. Probiotics are additive. They are not a replacement. You absolutely must keep up with your mechanical cleaning, the brushing, the flossing. That's non-negotiable.
Foundation first.
Exactly.
Yeah.
Secondly, you need to be targeted. use a product specifically designed for the mouth.
Why is that so critical? Can't I just swallow one of those cheap probiotic capsules for gut health? Does the delivery method really matter that much for the mouth?
It matters hugely because those beneficial bacteria need contact time with the surfaces inside your mouth, the tongue, the gums, the teeth surfaces, to actually colonize, to stick around and set up shop.
Ah,
A pill designed for the gut just passes right through the mouth too quickly. It doesn't linger where it needs to. That's why you see oral probiotics, typically as lozenges, or chewable tablets, or sometimes powders you apply directly. They're designed to maximize that contact time right where you need the bacteria to work.
makes sense. So when you're looking at different products on the shelf, what should you look for on the label to figure out if it's a quality product?
Good question. You want to look for clear quality markers. First, the specific strains of bacteria used, not just a generic probiotic blend, but the actual scientific names of the strains.
Like Lactobacillus reuteri or something specific.
Precisely. Second, look for the CFU's colony-forming units. That tells you the dose, how many live bacteria are in there. You need a sufficiently high dose relevant for oral use. Third, check if they include other supportive ingredients. Often these oral formulas add things like zinc or xylitol, which can provide additional benefits for breath or microbial management.
Okay, specific strains, CFUs, maybe extras like zinc, got it. Now, you mentioned earlier, and it's important that probiotics won't reverse active disease. How do you manage expectations for someone who might hope this is a magic bullet for, say, deep gum pockets?
Yeah, we have to be really realistic here. Probiotics can be excellent for prevention, for maintaining health, and for improving milder issues like gingivitis or bad breath over a period of weeks. But they simply will not repair significant structural damage already caused by advanced gum disease.
So if you have bone loss, deep pockets.
You need professional treatment, things like scaling and root planing, maybe even surgery. Probiotics can be a great support tool after that professional treatment to help maintain the results and encourage healing, but they aren't the primary treatment itself.
Right. And finally, I imagine talking to your dentist is key.
Always. Always discuss starting an oral probiotic with your dentist or hygienist, especially if you have any immune system issues or if you're taking antibiotics or just finished a course.
Why after antibiotics specifically?
Well, antibiotics, while necessary sometimes, tend to wipe out good bacteria along with the bad. So many dentists actually recommend starting an oral probiotic course right after you finish antibiotics to help actively restore that beneficial microbial community that got disrupted.
Ah, that makes perfect sense. Which brings us to maybe the biggest practical question, the real dilemma.
Hmm?
You've got the antiseptic mouthwash trying to sterilize and the probiotic trying to populate. Can you even use both? Don't they just cancel each other out?
You absolutely can use both, but you hit the nail on the head. The timing is everything. It's the crucial detail that determines whether it works or fails.
How so?
Well, think about it. If you use a strong antiseptic mouthwash, something designed to kill bacteria, and then immediately pop a probiotic lozenge in your mouth.
You're just killing the good guys you just introduced.
Exactly. You're essentially washing those beneficial bacteria down the drain or killing them off before they even have a chance to adhere and colonize.
It's like planting seeds in your garden and then immediately spraying weed killer everywhere.
Perfect analogy. So the guidance is clear. You need a waiting period. The source material strongly suggests waiting at least 20 to 30 minutes after using an antiseptic rinse before you take the probiotic.
20 to 30 minutes. Okay.
Yeah. That gives the chemical activity from the mouthwash enough time to dissipate so it won't just immediately kill the probiotic strains. A really common practical tip dentists give is maybe use the antiseptic rinse earlier in the day if you feel you need it for some reason.
And save the probiotic for later.
Right. Often recommended for the very end of your nighttime routine. After brushing, after flossing, after everything else, pop in the lozenge or chewable right before you go to sleep. That gives the bacteria the longest undisturbed time to get established.
Okay, that timing aspect is huge.
So just to kind of pull this all together from the dental community's perspective, there's real optimism about this probiotic approach. It feels more nuanced, more sustainable, and it lines up better with how we now understand complex biological ecosystems.
But there's still a but, right? It's not like we're throwing out toothbrushes and floss anytime soon.
Oh, absolutely not. The caution is still there. We have to remember this field is still evolving, research is ongoing, and importantly, product quality varies a lot. That's why checking for those specific strains and CFUs on the label is so vital.
Right.
Probiotics are best seen as a valuable supportive tool. They help the mouth maintain its own natural balance and defenses. They're definitely not a magic cure-all or a substitute for professional care when you have active disease.
That really gives you a whole new framework for thinking about and buying oral care products. Okay, so here's the provocative thought we want to leave you with, really stemming from that timing conflict we just discussed. If the big goal, the future of oral health, is about achieving and maintaining this long-term ecological balance using tools like probiotics, well, how often should we really be disrupting that carefully cultivated balance with those powerful short-term antiseptic blasts? Maybe the effectiveness of your whole routine hinges less on which expensive products you buy and more on the sequence and the timing of using tools that seem to have fundamentally opposite goals. Definitely something to explore further with your own dental professional.